Good morning, everyone. We are going to wait just one more minute and see if we can get a couple more people on. So let's just give it one more minute. All right, everyone. Good morning. We are at 2 minutes after, so we'll go ahead and get this show going. So my name is Jackie. I am the community health nurse supervisor for Two Rivers Public Health Department. So just have our clinical update today. So we'll go through the slides as usual, and then we'll send those out at a later time as well. So first off, I just did a pretty picture for Nebraska. It kind of looked like this morning's sunshine. So just a nice way to start our day off nice and bright. Our first slide is the Two Rivers Public Health Department counties that we serve. So we have 7 counties that cover 4,624 square miles. So we have Buffalo, Dawson, Phelps, Kearney, Harlan, Franklin, and Gosper. This slide highlights what we do here at Two Rivers, including disease surveillance, chronic disease prevention, and emergency response. This is a reminder of our mission and our vision. In short, we want healthier communities for all. This is our Two Rivers Public Health Department nursing team. So from left to right, we have Marilyn, Rita, Elizabeth, Jordan, Jackie, and Rosa. And this is just a reminder that our website has changed. So we now are trphd.ne.gov. So just be sure to make sure that you guys have that updated in your guys's emails and our website. And this is another little extra reminder. So my email address will be changing. It is not complete as of yet. So once it is complete, I will send out an email to all the clinicians to update everybody when it is complete, but it will be jhaley@trphd.ne.gov. So just no surprises if you guys see a different last name for me. This map is a reminder of the region that Nebraska falls in. So we are region 7, along with Iowa, Kansas, and Missouri. And now we get into the nitty gritty. So this is our COVID by the numbers. This is updated January 9th. So total US confirmed cases, we're at 101,094,670. Our 7-day average per 100,000 people were at 141.8, and total US deaths were at 1,091,184. So we also broke them down, the numbers for our region 7. So that's Nebraska, Kansas, Missouri, and Iowa. So for Nebraska, total confirmed cases of COVID is 556,528. And total deaths for Nebraska were at 4,723. Kansas, we're at total confirmed COVID cases of 919,598. And total confirmed deaths, 9,754. Missouri, we're at total confirmed 1,739,403, and total deaths, 22,287. And finally, Iowa, total confirmed 888,667, and deaths 10,463. I also provided you guys the maps. That way you can kind of see what we're doing for our colors. And then I also put the numbers of what our 7-day average per 100,000 people are for the states, Nebraska, and everyone around us. So you guys have that. Next up, we have Two Rivers Public Health Department COVID-19 dashboard. So the top left is our rolling 7-day average. This is a comparison from December 11th through January 9th this year, which is in orange, and last year in blue. The amount of reported lab tests for COVID are much lower, and this might be due to lower circulation or due to home test kits that do not report deaths, or both. The bottom left, we have our weekly tests versus positives. We see a steady decrease in positive tests starting December 11th, where we had 165 positives recorded, to last week, January 1st, we had 53 positives recorded. In the middle, you will see our district daily case rate per 100,000. So we were at 8 cases per day, about 8 cases per day in the last week. The top right graphic is the county levels, which are significantly lower than they were noted in early December. So that's great. And then the bottom right graphic basically is showing you who is being affected by COVID by age group. And it looks like people testing positive for COVID is pretty split evenly among age groups. Do have a little bit higher in the 30 to 39, but pretty even. Up next, we have our influenza surveillance. So this information can be found on the CDC Flu View. This map, I watch it every week to see what colors we have and to see how we compare to other states. Since November, Nebraska was purple, which was the very high. And recently we went down to the second highest color, that really dark red. So we're still pretty high, but we did have a decrease. So that's what we want to see. And as always, CDC recommendation continues to be that everyone keep up to date on their influenza vaccines. This is Nebraska influenza information. So looking at RSV and influenza, our most updated data indicates that influenza A and RSV cases have decreased. Yay! The two most common influenza subtypes are H1 and H3, with H3 causing most of the cases. But the good news is that this season's flu shot provides coverage for both of these subtypes for influenza. So decrease in both, that's what we want to see. So hopefully we have already seen our peak. This will be our last monkeypox update. So we were doing these weekly, we span them out to every other week in December. And due to no cases in the last 10 weeks in Nebraska, we are not going to be sending this out anymore. But we can kind of go over this last one. So this one was updated December 22nd. So total cases December 21st, was 29,740, and total US deaths was 20. Total global cases was 82,999. And Nebraska, we had 31 cases, but we did not have any in the last 8 weeks, and that was back December 22nd. So now we're looking at about 10 weeks. So as you can see on our graphs, we flatlined, we didn't have any more of a peak. So that's what we wanted to see. So the good news is you guys won't just stop hearing from us. We will still be sending out a monthly education. So this will vary month to month on the topics. So just be looking for your emails for that new monthly education. COVID data tracker weekly review. So for this week, the title was New Year, Same Variant. So this COVID data tracker weekly review helps you navigate the two methods the CDC used to display variant proportions, which are weighted estimates and nowcast estimates. So in summary of the data, XBB.1.5 is spreading quickly. And at this time, CDC's COVID-19 guidance remains the same about how people can best protect themselves from serious illness. CDC will continue to investigate the ways in which XBB.1.5 may be different from other Omicron lineages, and will continue to update COVID data tracker variant proportions page on a weekly basis. So, radon. So January is National Radon Awareness Month. So wanted to kind of talk to you guys about what radon was and some of the things that we have available in January. So radon is a cancer-causing radioactive gas that is naturally occurring in the soil and bedrock below our homes. Because it is a gas, radon can move through soil and into our homes. You cannot see, smell, or taste radon, but it is important to know that the level of radon, or it is important to know the level of radon in our homes. Radon is the leading cause of lung cancer among non-smokers, and Nebraska has a very high incidence of radon in homes, with over half of the homes that tested in Nebraska having levels above the need to take action level of 4.0. So since January is National Radon Awareness Month, Two Rivers Public Health Department has free test kits to give out this month. So if you or a family member or a friend are in need of a radon testing kit, please contact Two Rivers for more information. So this is a recent study that I came across, and it basically states that there has been increasing reports of perioditis and, I can't say these today, sialadenitis, and these are also testing negative for mumps in the United States. So commonly perioditis and sialadenitis are clinically present in mumps cases, and mumps can be confirmed by lab testing. We are seeing high fevers that accompany the perioditis and the sialadenitis, which is not usually occurring with mumps. And so I just wanted everybody to be aware that they are seeing this across the United States. You know, the lab confirmation, when you see the perioditis or the sialadenitis, they're not getting the lab confirmed mumps with that as well. So there is a link in there for you guys for a PubMed for the study, but just wanted everybody, all of our clinicians, to be aware. All right, so mycoplasma genitalium or MGen. So this is a new STI. So it is an STD that can cause infection among people of any gender. So I just wanted to let you guys all in on the know. This is something that came out recently. MGen is what they call it. It can infect the cervix, the opening of the uterus, inside the penis, the urethra, or the rectum. And you can get MGen by having vaginal or anal sex without a condom with someone who has an infection. And people with MGen also can have no symptoms. If you do have symptoms, you can notice vaginal discharge, a burning sensation when peeing, discharge from the penis. And if you have any of these, you need to see your healthcare provider and be checked out. I also have provided 2 links on this one for CDC on MGen. So that way you guys can have a little bit more information. Dental screenings. So we have our Life Smiles program through Two Rivers Public Health Department, where we do free dental screenings ages 0 to 4. So our Life Smiles program continues to see patients in our district. So please check our event calendar on our website for dates and times. I also put the link for our events calendar on there. That way it made it easy for you guys to check dates and times. Our reminder that Two Rivers Public Health Department still is doing COVID testing at the Two Rivers Public Health Department office. We continue to do this on Mondays and Wednesdays from 9:30 to 10:30. And all those wanting to be tested must register at trphd.ne.gov. And that is very important to be registered before you come. If you do need help, we can help you over the phone or once you get here. And then I have provided you guys what we have up on our website right now for events. I do urge you guys to check this often and not just print it at the beginning of the month. We do add anything as we're going through the month. So we do constantly update this. So, but if you ever need to know where we're going to be for the month, this is a great option for you. And finally, I have my last slide. And so this is just a reminder that Two Rivers will be closed on January 16th in observation of Martin Luther King Jr. Day. So that is all I have for today. So I will go ahead and open it up for any questions. And you can either unmute yourself or you can put it in the chat. And I'm not hearing anything and I'm not seeing anything. So I'm going to give everybody the gift of time. So thank you guys, and we will get this sent out to you guys in an email. And then probably later this week, beginning of next week, we'll be sending out the education for this month. So if you guys have any questions, please don't be afraid to give us a call or an email. Thanks. Have a great day.